So it will be stop yesterday for Medicare, key takeaways, what isn't covered by Medicare, Medicaid. Yeah, we need to start from here.
We have, yeah, we have to start from here.
From here. Okay, cool. So let's try to understand. So yesterday we learned about Medicare, Medicaid. What is the importance of healthcare? Now, what is the need for health insurance and things, right? Now let's try to understand the various components that are there as part of healthcare, right? The first one is premium itself. It is a pretty straightforward one. The amount the policy holder or his sponsor. Sponsor means if this insurance is provided, is paid by the employer, then that the sponsor will be paying, right? The amount that would be paid by the sponsor, that's the employer. So basically, this is the amount that has to be paid to the health plan to purchase the health coverage. Okay, that's a premium. It can be a monthly premium, yearly premium, quarterly premium. That's how it is, right? Or is it always annual there?
No, it is also like monthly, like how you said,
Monthly.
monthly.
Yeah,
Yeah.
yeah. Okay, sure. So that's the premium. Deductible. What is deductible? Deductible is nothing but the amount that the insured, that is, it can be you or anybody who's getting insured, they must pay out of pocket before the health insurer pays its share. So before the health notes insurance company pays its share, you need to pay out of the pocket. That's deductible. Example, see the policy holders, they might have to pay a $500 deductible per year before any of their health care is covered with the health insurer. Right? It might take several doctors' visit of prescription refills before the insured person reaches a deductible and the insurance company starts to pay for the care. Like if you're doing some $100 thing, then that doesn't work, right? So it has to. In this case, what I'm saying is you might have to pay a $500 deductible per year before any of the healthcare is covered by the health insurance. Okay, does this make sense?
Yes.
Okay. Then comes the co-payment. What is co-payment? The amount that the insured person must pay out of pocket before the health insurer pays for a particular visit of service. What is this? So, example, an insured person might pay a $20 co-payment for a doctor's visit, just for doctor's visit. The you or me, the insured person, we may have to pay $20 here, no, or just for visit or for a prescription. So, and this co-payment must be paid each time a particular service is obtained. There's a small amount that has to be paid every time a service is obtained. That is co-payment. And now what is co-insurance? So, co-insurance is, instead of or in addition to paying a fixed amount upfront, what is that a fixed amount that you're paying upfront? That's the co-payment here in case $20. The co-insurance is a percentage of the total cost that the insured person may also pay. Actually, co-insurance is a percentage of the total cost of like if it is $1,000, what is that percentage of cost out of $1,000 that you are paying? That can be co-insurance. Like example, the member might have to pay 20% of the cost of a surgery over and above a co-payment, while the insurance company pays the other 80%. 80% is paid by the insurance company, 20% you have to pay. If there is an upper limit to co-insurance, the policyholder could end up owing very little, right? So, or a great deal, depending on the actual cost of the services they obtain. Uh, Okay. Any questions here?
Yes. So isn't that co-insurance similar to co-payment, or is it different?
Co-insurance is different to co-payment. Definitely, it is different. No, because as part of co-insurance, you
Mm-hmm.
are paying certain percentage of amount of this total bill.
Okay, percentage. Okay,
Yeah,
got it.
certain percentage of amount of the total bill. Okay, makes sense.
Yes.
Okay. Then exclusions. What are exclusions? Exclusions are usually there will be services that will not be covered, right? Those are called as exclusions. So, so the insured are generally expected to pay the full cost of non-covered services out of their own pockets. Usually, they give the list of exclusions. So you need to see that when the patient needs to see that, understand what are the exclusions, and make sure to adhere to it accordingly. And the payment has to be paid by the the patient for the all the exclusions. Okay. And then we have coverage limits. So some health insurance policies only pay for the health care up to a certain dollar amount. Some health insurance policies only pay for healthcare up to a certain dollar amount. Now there might be a limit, upper limit, and the insured person may be expected to pay any charges in excess of the health plan's maximum payment for a specific service. So assume the maximum, the upper limit I'm mentioning here is assume it is $5,000, right? Anything above that has to be paid by the a patient. Okay. In addition, some insurance companies schemes have annual or lifetime coverage maximums. This is one-time coverage, but there are chances that many insurance companies they'll have look annually this is your upper limit, or in a lifetime this is your upper limit. They'll define that. So based on that, you need to see what is your coverage limit, accordingly you may have to pay the rest of the amount. Okay. In these cases, the health plan will stop payment when they reach the benefit maximum. Once you reach $5,000, assume if that's the threshold, then they'll stop payment, and the policyholder must pay all the remaining costs throughout the remaining year. Okay. Any questions?
No questions.
No. Next is out-of-pocket maximums. So similar to coverage limits, like except that in this case the insured is full for the costs, right? Out-of-pocket maximums can be limited to specific benefit category, like it can be a prescription drug, or this can also apply to all coverage provided during a specific benefit year. Okay, so out-of-pocket maximum is it can be limited to a specific category, or it can be applied to all coverage provided during a specific benefit year. During the specific benefit year, this out-of-pocket comes into picture. Okay, out-of-pocket maximum comes into picture. Okay, and then capitation. What is capitation? Capitation is nothing but you know the amount paid by an insurer to a healthcare provider, for which the provider agrees to treat all members of the insurer, right? So there is an amount that is paid by the insurer to healthcare provider, where an agreement is made saying that okay, the the provider in this case is agreeing to treat all members of the insurer. Okay, does this make sense? Any questions here?
No questions.
Okay. Next is fee for service. What is fee for service? Fee for service is a payment model where services are unbundled and paid for separately. Meaning it won't be clubbed and it won't be bundled. However, it will be unbundled, and for each line item, they need to pay for it separately. That is fee for service, right? So in the health insurance and the healthcare industries, Fee for service occurs when healthcare providers receive a fee for each service, like even for a visit, B for some test, B for some procedure, healthcare service, doctor visit, or the medicines. So all those are fees for service, fee for service, and have to be unbundled, and maybe have to be paid for it separately. Okay, that's fee for service. Next is in-network provider. So what is in-network provider? In-network provider means the healthcare provider. The healthcare provider on a list of huge list of providers pre-selected by the insurer. Here, the you know the you know the healthcare provider is pre-selected by the insurer, and the insurer will offer discounted co-insurance or co-payments. The insurer will offer discounted co-payments of co-insurance or additional benefits to a plan member to see an in-network provider. Okay, so these are the benefits that gets insurer gets. Generally, providers in network are providers who have a contract with the insurer to accept rates further discounted from the usual and customary. So that would be discounted rate, and you know discounted from the charges the insurer pays to out-of-network providers. So these discounts are applicable when insurer pays out of the network providers. Okay, this is in-network provider and fee for service. Any questions here?
No questions.
Okay. Prior authorization and EOB. Let's try to understand expectation of benefits and prior authorization. What is prior authorization? Prior authorization is nothing but certification or authorization that an insurer provides prior to the medical service starting or occurring. Okay, so the insurer provides a authorization saying that okay, look, um, look, the as an insurer, I'll be obligated to pay for the service. I'll be ready to pay for the service. Okay, so obtaining an authorization means that the insurer is obligated to pay for the service, assuming it matches what was authorized. So many smaller routine services do not require authorization. Okay, small things you need not have that authorization, but for big things, right, you have to get that authorization from the insurer, saying that they'll be ready to pay for it. Okay, that's prior authorization. Explanation of benefits. So this is a document that may be sent by the insurer to a patient. A document that is sent by an insurer to a patient explaining what was covered for a medical service and how payment amount and patient responsibility amount were determined. What was what was covered, and if I'm charged X amount, how did that figure come up? That breakup, would be shown. How payment amount and patient responsibility amount were determined. Okay, make sense? Any questions?
No questions.
Okay, so these are few terms on the uh, you know healthcare components of healthcare. Now let's try to understand the types of health insurance coverages. Okay, so health insurance is meant to cover a variety of medical expenses, right? Variety of things, like it can be a couple of examples that's mentioned earlier. You know, these few list of things that is mentioned might be might be covered as part of major or many policies. So first one is physician visits, and then the hospitalizations, physical therapy, occupational therapy, speech therapy. All these things can be covered. Prescription drugs, preventative health care, lab tests, mental health, certain medical equipments, rehabilitation costs, dental care, vision care, right? So, so all these things are covered under most of the policies. Okay, make sense?
Yes.
Now let's try to understand the types of health insurance coverages. What are the different ways the health insurance can be obtained? Be it individual health insurance, group health insurance. Let's try to understand those things. How can they get it? So, individual health insurance is often used by people who do not have the option of group coverage. Assume they don't have the option of group coverage, then they go for the individual health insurance. So, it allows for a tailor-made policy. Yeah, it's like they can cherry pick what they want. No, it allows for a tailor-made policy that fits exactly what the person needs. Right? No, you don't unnecessarily take things that are not required. So you can cherry pick and check and select only things that you might need. And this type of insurance is usually relatively inexpensive. Usually, it is relatively inexpensive when compared to group plan. Okay, the cost of an individual health insurance plan will typically be about half the cost of group. The cost of the individual health insurance plan will typically be about half of the cost of a group and health insurance plan for the same benefit amount. Okay, any questions here?
No questions.
Okay, next, group health insurance from an employer. This is the most common one where your employer will provide a health insurance for you. Your employer will provide health insurance for you. So this is a much more affordable type of health insurance only when your employer will pay for most of most or all the premium, right? Which most of the employers will do this. And since the premiums are based on the group as a whole, the risk is spread out over many people, right? Because it's a huge group of people, so the risk is spread out. And these policies are often the most popular type of private health coverage. Yeah? These are the most popular type of private health coverage. One of the benefits to group health insurance coverage is that one cannot typically be denied coverage due to pre-existing conditions or other health problems, right? So the chances of getting denied is is very very less. Okay, so that's the advantage that we have in terms of group health insurance. And there may sometimes be a waiting period if one has not maintained continuous coverage, but everyone will be accepted eventually. But you know, there might be waiting period, based on the continuous coverage that's been maintained. Okay. Any questions on this?
No questions.
Okay. Now let's try to understand group health insurance from a non-employer group. This was from an employer. Now let's try to understand from a non-employer group. So this is another option to consider for obtaining health coverage for those who have no policy available through work or an inadequate one, or you you either don't have a policy from work, or you have it from work but it's a very small one that's not sufficient for you. Then the group rates can be obtained from church groups, professional and business associations like a chamber of commerce. Okay. Now, how will this help? This will help you obtain health insurance if you are unable to obtain a individual health insurance policy due to your health. There are chances that due to your health issues, you will not be able to get the health insurance policy. In that case, they can always enroll for this church groups once. Okay. Any questions?
No questions.
Okay. And then comes the student health insurance and short-term health insurance. So, what is student health insurance? Student health insurance is usually either a temporary health insurance plan, which is offered, which is usually offered through the university or college, and may sometimes be available through a private insurance company. Okay, so this is mostly a temporary insurance plan, which the universities or someone they'll subscribe to. Okay, short-term health insurance is a plan that is, as its name implies, only offers coverage for a short amount of time because it's a student health insurance, students will not be there forever. and in the same university also, right? So it can be for a short amount of time, usually anywhere between 1 month to 1 year. Although some short-term plans offer coverage up to 3 years also. Okay, does this make sense? And although
Yes.
short-term, yeah, and also although short-term health insurance plans are typically very cheap, they're also typically very bare bones coverage. It doesn't cover lot of things, right? Bare bones coverage, and should never be relied upon a long-term solution to finding affordable health insurance coverage. Given that it's a student health insurance, the benefits and everything would be little lesser here. Okay, let's move on. Now, COBRA. So COBRA stands for Consolidated Omnibus Budget Reconciliation Act. Okay, stands for Consolidated Omnibus Budget Reconciliation Act. So what does it do? It gives you the right to choose to keep the group health insurance benefits, right? It gives you the right to choose what are the benefits that you want, what are the benefits that you don't want, what are the benefits that might work for you or not work for you. So accordingly, you can go for it, right? So it gives you a right to choose to keep the group health insurance benefit. And then we have, Cobra also lets family members choose to keep health insurance after your job loss or other qualifying event that would normally cause them to lose the coverage they have through your employer, right? So if there is a job loss or something, or any other case where you have to be covered apart from the employer, then this is where it comes into picture. And in most cases, you can keep the insurance for up to 18 months. Some people may be able to keep it for a couple of months longer also. Okay, this is on Cobra. Any questions so far?
So for the Cobra,
Mhm.
is it like some is a different kind of insurance?
Uh, like,
I mean, I heard about the
uh,
Cobra, and this part I don't have any idea on.
see,
Um,
assume you have a
mm,
health insurance that is provided by the organization. Okay, now assume the insurer, this person loses the job. So in this Cobra case, you will be allowed to keep still have that insurance. You'll allowed to you will be allowed to still have that insurance in place, and you'll be able to keep it and continue it for couple of months, right? Uh, so that you don't lose the coverage immediately, and lose the employer, whichever whoever had provided that insurance, right? That will be
mm,
still kept for you.
okay,
So,
okay.
and you will keep that for up to 18 months. Some people
Mm,
may be able to keep it a few months longer.
mm,
So,
yeah.
make sense?
Okay.
So, qualifying events for spouse or dependents of the employee who had been included on the employee's health plan include the insurance, the insured employee's death, right? So, assume the insured employee dies, then
Mm,
their family members will be allowed to have that insurance for 18 months to or few more months, right? For the family. Or in case of divorce or legal separation from insured employee, that then also this would be applicable. Loss of dependent status, so our employee becomes entitled to Medicare, and the employer takes him on or her off the health insurance plan. So once this employee becomes entitled for Medicare, then they might take out of the health insurance plan, right? Then Cobra comes into picture, and the dependents might be having that 18 months of coverage also. And any event in the list here, right, that causes the employee to lose health coverage. Okay. Yeah. Any questions?
no questions.
Okay. Next is types of health insurance. What are the various types of health insurance that is there? So like HMOs, PPOs, POS. You must have heard of it, right? So, as part of this module, we'll discuss about indemnity plans or managed care, HMOs, PPOs, POS plans, group health insurance, individual health insurance, vision care insurance, dental, Medicare, Medicaid, Medigap insurance. We'll try to discuss all these things as part of this module. Okay, so we'll continue on this tomorrow. Is it okay?
Okay. Okay.
Fine. Any questions before we close for today?
No
Priyanka?
question.
No question. Okay, we'll close for today and we'll continue tomorrow.
Okay.
Okay.
Thank you.
Thank you. By the way, tomorrow, shall we do 4 a.m. IST?
4 a.m.
IST.
Like, so
One
if
and a
it's
half
for.
early, 1.5 early than today.
Yeah, 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 yeah.
Hmm?
Earlier
Okay.
is actually better for me.
Yeah, yeah, yeah. 4 a.m. Okay.
Yeah, okay, okay. No
Oh,
problem.
okay then. Huh? Thank you.
Thank you.
Thank you.